The fog and smog here in the air around me in Salt Lake City right now. A reminder of the air quality issues we faced the past several decades here in this area. Hello, I'm Fox 13 News anchor Amy Nay. Some good news on that front after the EPA this past week announced Salt Lake City and Provo had hit a major milestone. However, a warning from doctors as we head into the upcoming inversion season.
We haven't solved our air pollution problems by any means. And in fact, we need to be very leery.
Dr. Brian Mensch is president of Utah Physicians for a Healthy Environment.
The medical literature is very clear that there's no safe level of air pollution you can be exposed to.
This weekend's air pollution captured on our Natural History Museum camera in this time lapse showed moderate, but even that can cause problems.
The research that shows smoking one cigarette a day is virtually half as much risk as smoking an entire pack. In other words, the first few additions of air pollution to the community airshed are having the greatest impact. So everyone should look at the whole situation here with air pollution on the Wasatch Front as we should always strive for as clean air as we can get.
The air quality in Salt Lake City has actually gotten much better over the last 20 years. And people are just more aware of pollution now and more aware of the linkages between air pollution and human health.
Which atmospheric sciences professor Kevin Perry from the University of Utah concurs are not good.
Yeah, absolutely. Being exposed to pollution, and in the wintertime, we're mostly talking about particulate matter.
We should acknowledge progress made. Last week, the EPA announced after 15 years on the agency's non-attainment list, Salt Lake City and Provo now meet federal standards for fine particulate matter, or that dangerous PM 2.5.
There's always a gap between what the health community wants for air quality standards and what we eventually get from the EPA. So some kind of standards are better than no standards, but people need to understand that there are limits to what those standards can tell us in terms of whether or not there's a public health problem still.
We always have to be diligent. We live in an area where the meteorological conditions basically are poor for air quality.
Commending those who've switched to electric vehicles and taken other conservation methods.
Is it fair to say that some of those maybe seemingly small actions really can add up to make a big impact?
Oh, absolutely. That's how one of the ways that we've actually gotten to the attainment status was the improvements in the efficiency of vehicles. We use less fuel per mile than we have in the past.
The state's invested in cleaner transit, vehicle upgrades, and public education, but we're all advised, despite this glimmer of hope, we should remain diligent.
Generally, winter inversions are a little less severe than they've been in previous years.
But Dr. Mensch says that's being offset by longer wildfire seasons and more dangerous wood smoke in the air, along with higher ozone levels and the shrinking of the Great Salt Lake, which could lead to toxic dust.
There's no safe level of air pollution. And so people need to take as much proactive, protective actions as possible.
Reporting in Salt Lake, Amy Nay, Fox 13 News, Utah.